A bit of health now. Nursing mothers with difficulty producing breast milk can now smile. There is a breast milk bank in Lagos where they can get this nutritious and essential meal for their babies. Sarah Yeko has details.
When a baby is born, it essentially cries for food, but not all nursing mothers can immediately feed their babies with the breast milk, God's gift to mankind, and primary source of nutrition for newborns, which contains fat, protein, carbohydrates, and variable minerals and vitamins. Known as the breastfeeding doc on social media, Dr. Chini Obinwani has taken a step further from milk boosters to having a milk bank that provides pasteurized donor breast milk for preterm, low birth weight, and other vulnerable infants. Now, babies have access to breast milk when they need it.
65% of our babies are dying within the age of 0 to 5 years within Nigeria because we are doing suboptimal breastfeeding. It's painful to watch because Nigeria has the capacity to sustain these babies. So I'm here to say that Nigerian babies, no matter whether they are born premature, no matter whether they're born full term, they have a chance at living, finally.
According to the World Health Organization, among the top 10 countries with the greatest number of preterm births, Nigeria sits at the third spot with the highest infant mortality rate and yet no breast milk bank.
We don't sell breast milk, and mothers are not giving it for a financial benefit or something. They voluntarily give this as the same way we would voluntarily donate our blood. Okay, so we don't sell. What people would pay is a service fee that covers the cost of screening a mother. Even within Africa, Kenya has human milk bank, South Africa has, but a country, the giant of Africa, does not have one. Our future should have been yesterday.
Although there are misconceptions fueled by religion and tradition on receiving donor breast milk, their campaign is, why allow a cow feed your baby when you can have another woman's breast milk nourish your newborn?
People are sharing breast milk informally, so want to make it formal and be sure that diseases are not being passed across in the breast milk. So we have a community spanning over 165,000 mothers, and while we are starting from there, we're already generating demands from there.
Breast milk is very, very important for children to have breast milk, and that's why we advocate for exclusive breastfeeding for our babies. But for some mothers that might not be able to produce enough, I feel they will benefit from this milk bank.
The team is pooling breast milk from volunteers. One of them is Miss Lillian, a mother to a 2-month-old baby.
I'm a new mom, first-time mom, and I've learned a lot about breast milk in these last 2 months that I've been feeding my baby, and to see him just take that and nothing else. So I imagine other babies that don't have that chance. And then because of the importance of breast milk, how it saves children from a lot of sicknesses and a lot of problems later in life, I think if moms have excess production like I do, they should give out. They should donate. Thanks to Milk Bank, we can now pasteurize it and ensure it is safe for babies to use.
For now, the milk bank has the capacity to produce 135 liters of breast milk weekly. It hopes to increase its capacity to 200 liters in the next 3 months. Sarah Ayeku, TVC News, Lagos.